kids are really struggling. So let me give you some numbers to understand what is going on with the state of their mental health and well-being. 50% of all lifetime mental illness shows up by just the age of 14. Now, I want you to think about that for a second. Where are those kids? That's right. They're showing up to your schools. They're in your middle schools. And so that is where we're starting to see some of these behaviors. But guess what? This is K through 12 education. Kids on the elementary level are showing these behaviors. And if we can help them cope and manage those behaviors there, then they're going to get to the middle level of education and they're going to do better. And if we address their behavior issues there and really understand what kind of support they need, then they are going to do better on the high school level. All right, here's another number. 1 in 7 youth experience a mental health condition globally. So there's a lot going on. And what I keep seeing in clinical practice is this. I'm seeing depression, anxiety, and behavioral issues show up. So in the younger years, elementary level, the primary levels, there are a lot of behavioral disorders showing up there. And as they get older, typically around adolescence, the other kinds of mental health problems will start showing up just because of the way their brain is changing. And so these are going to emerge as a way of coping with distress. And so depression and anxiety are like best friends. They show up together all the time. So couple that with behavioral issues and stress of just trying to figure out who we are as a human in the adolescent stages of life. And then the stresses and strains of having to do well as a student and your peers, all of these things are going on at once for kids. And so that's why you're seeing these problems in your classrooms. The thing is, we don't really understand them all the way. So let me show you one more number. And I want you to understand this is a big problem in our classrooms, especially in a traditional setting. Now, I know a lot of you are doing a great job and you're supporting kids differently in your education systems, but sometimes we don't have control over our environment the way we want to. 15 to 20% of the world's population is neurodivergent. And that might be you as an adult too. So let's group that together. We have a whole system of people trying to work in a system where we have to sit a lot, sit and try to learn something. And there are just so many environmental factors influencing us, not to mention internal factors going on. And these are some underlying issues. Now, we've done a lot of research around this, and we have it kind of in a puzzle so that we look at it not as another piecemeal solution, but as the whole solution. If we identified these 9 underlying issues, and now we have a skill or a way to address them, that's how we're going to make a true transformation in the whole system. And we want to equip everybody in the system with tools to respond effectively to these underlying issues. All right, so here's another piece. I need you to understand the stress response system in your brain and the body and how it's all connected. If we could teach this to kids and also notice this in ourselves, then we're going to understand that we're all walking around like a bunch of nervous systems, and they may come to your classroom or your space or your meeting that you're leading dysregulated or on high alert. So we need to understand what's going on in the body. And it starts in the brain. So your response in the brain to the body is the fight, flight, or freeze mode. You're going to either run away, you're going to fight the tiger off, or you're going to freeze. And hopefully you didn't do that because that would not be a good outcome for you. But once you knew that you were safe and you thought, I'm alive, then guess what happened to all those hormones and the blood that rushed to your large muscles to help you run or fight? Or the adrenaline that rushed and surged through your body, it all subsides. It goes back. And that's when you know that you can function well. And our brain still functions the same way, but our environment has changed tremendously. And imagine an environment full of potential threats that cause us to think that we have more to do, more to address, have constant uncertainty, negativity, behaviors, and just so much to think about. And so our environment is constantly flooding our system, and we're constantly in a state of threat and pressure. And that's not a way to function in our system right now. That's why you're seeing so many behaviors. These are all behaviors that are showing up. So I want you to take a good look at the wheel of reactivity and see what you're witnessing in your own systems, in your classroom, your hallways. Look at the one that's on the very bottom. And this is somebody who's just kind of walking through, just depleted. And look at the one to the right, kind of at the 3 o'clock. I mean, have you ever tried to lead a meeting or a classroom and this is the face that's looking back at you? And when we don't know what to do, we do nothing or we continue to do the same things over and over that were never working in the first place. So we're feeling so depleted, aren't we? It's really about that system overload and it's the body's way of reacting. So it's not that these kids are saying, I want to refuse my work. I want to argue. I want to yell. I want to have this hyperactivity and walk around the classroom or kick my chair or tap my pen that's bothering you. They don't want to do that. That is their nervous system responding to overload. And imagine if we had an entire system working on this, calming our own system, we'd all be functioning so much better and showing up for kids better and each other. I'm going to share my screen. We're going to do a couple more together. This is a really good way to just shift that energy or the tension out of the body in a very quick way, and it's free. You don't need a budget for this. All right. And there's lots of these. I have several of them for you that I'll give to you. But here's another one. You just press your hands together like that. Press really hard for 5 seconds, and you can lead a whole classroom to do this. In fact, when you notice kids are about ready to, like if they're squirming around, stop what you're doing because they're not listening anyway and have them do a rapid reset. It helps them and you. And yes, I see questions about, can we do this with older kids? Absolutely. We have to, even in higher level education. And by the way, even for adults. So all adults and all kids benefit from this kind of movement. We have to shift the way we've been doing traditional education and integrate this into our everyday practice. That's how we're going to make the long-term transformation. We can build capacity. We're not learning this in our teacher programs. And so we're entering the system without the capacity to respond effectively to student needs and have that classroom management, which starts with us.